Good day. Welcome to Westchester Talk Radio. I'm John Marino. We are produced by Sharc Creative, made possible by Robeson Oil, the house that service built. By Lipolis Electric, don't be left in the dark. Get Lipolis. By Hightower Westchester, managing your wealth to a fiduciary standard. By White Plains Hospital, by Michael Labriola Landscape Design and Construction of Armonk, and by Tompkins Mahopac Bank. Here on Westchester Talk Radio, what's happening in the Lower Hudson Valley? We are joined by Westchester County Department of Health Commissioner Dr. Sherlita Amler. Dr. Amler, thank you for returning again with us on Westchester Talk Radio. Seems like every time we get together, a new variant crops up. This time it's the Omicron variant, first detected in South Africa. What do we know about Omicron so far?
Well, unfortunately, it's been identified in more than, 57 countries and more than 20 states. And we have had, a case here in Westchester and several cases in the state of New York. So there's more that we don't know than we really do know. So I think the things that are most concerning to us is, are the vaccines that everyone has taken for COVID, are they going to continue to be successful in preventing disease? Or will this virus be able to escape the protection that vaccines have provided? And, what are the symptoms going to be like? It's what we're hearing right now out of South Africa is the symptoms in people who are vaccinated may be milder than Delta, but we don't know that for certain yet. So it's going to take a couple weeks before we know really what kind of symptoms to fully expect, how serious is this going to be. But the one thing that seems to be very apparent is for individuals who are vaccinated, they seem to, even if they get COVID with the Omicron variant, seem to be weathering it fairly well, without severe disease, hospitalization, and death resulting. So I think it just is a reminder to everyone that if they haven't been vaccinated, they need to get vaccinated. And if they still need their booster, to get their booster. And just today, I think it was announced that the FDA has lowered boosters down to 16-year-olds for Pfizer. So it was 18-year-olds and now 16. So if you have a child who's 16 to 17 years of age, they're now eligible for their booster if it's been more than 6 months since they got their second dose.
We've seen from certain corners about Omicron. It seems like, I don't want to say certain corners are trying to sweep it under the rug, but it seems like, to me at least, too many people are saying, well, look, if the symptoms in South Africa and other places around the world are not too serious, people aren't getting that sick. But I think you bring up a really interesting point that there's more we don't know about it yet. It's still brand new than what we do know about it. I understand people trying to want to get back to the way we used to live 2 years ago, but seemingly that's not possible just yet until we learn much more about Omicron.
Well, you could just take our case counts right now to kind of debunk the theory that everything is back to normal. Today in Westchester, it would have been yesterday's counts for positivity. So we had 568 positive cases of COVID in Westchester County reported to us yesterday. That is triple the number that we were seeing before Thanksgiving. So case counts are going up. Is that Omicron? I don't know yet. Is it just people getting together for Halloween and Thanksgiving? I don't have an answer to that at this point, but definitely the numbers are going the wrong direction, which is very concerning to us in public health and should be concerning to everyone.
Mm-hmm. And it could be two people getting together Christmas shopping in the malls a lot more than what they did a year ago.
Absolutely. Because, we all know that we're tired of this disease. We are so over COVID. But as I've said before, unfortunately, COVID's not done with us. And you see, when I go out shopping, I see no one in a mask. But now Governor Hochul is putting into place a mask mandate. I believe it's going to start Monday. That's going to require people to wear a mask in, public venues and establishments, unless that venue has a vaccine requirement to enter. So I think that's probably in response to the rising numbers that the state is seeing.
Mm-hmm. Now, the MU variant from South America came around a few months back. We were warned to be on the lookout for it, to be extra vigilant about it, as we've been, about Delta, about Omicron. Has MU, the Mu variant, as it's called specifically, has that advanced to any worrisome stage, or has that slacked off, basically?
Well, the MU, it kind of peaked in June and hasn't really been a factor at this time. It was found in about 40 countries, but it was only associated with about 1% of the total cases. And so initially it was categorized as a variant of concern by the World Health Organization, but I believe it's no longer classified that way. Mm-hmm. And so, Omicron has kind of come up on the horizon, but Delta is still the primary variant that we're seeing in this country. It's still the dominant variant, but it does have to concern you a little bit that Omicron has been able to take a foothold, given how transmissible Delta is. And so the concern is it more transmissible than even Delta? And again, only time is going to tell us that for certain, but it certainly is a little bit worrisome.
Mm-hmm. Now, less than 6% of the African continent is vaccinated. To me, that's an astounding number. I'm going to guess that it is for you two and for health officials at this point, a year into vaccinations. How do we get more people in the more vulnerable spots around the world? How do we get them up to speed vaccination-wise?
Well, I think that, that problem's a little bit higher than my pay grade, but I think the real issue is just availability of vaccine. I mean, these countries that are largely, some of them impoverished, just don't have the financial wherewithal. And other countries have, such as the United States, have donated large amounts of vaccine to these countries, but you also have to have the infrastructure in the country to put the vaccine that you get into the arms of people. And here in Westchester, I mean, we know what that takes to do. It's tremendous amount of staff time. It's, having qualified people. It's not as easy as just getting the vaccine to the country. You still have to have a mechanism to reach out to people in very remote areas, wherever they are. And these vaccines have really rigid refrigeration and freezer requirements that make it very difficult. So I kind of understand why they are having problems, and I don't think there's an easy solution, but hopefully things will continue to improve.
Mm-hmm. Now, we have a travel ban in effect from a number of African countries. Governor Hochul a week ago instituted in New York State a state of emergency and putting for now a ban on elective surgery statewide. Some say she overreacted. Some say she did the right thing in possible anticipation of what Omicron might bring. And we don't want to get into the situation where we were in 2020, where we were pretty much out of hospital beds at one point. Is there a happy medium to be reached in between both sides of overreacting maybe, or maybe underreacting just a bit?
Well, I think what they're trying to do here is to keep availability of hospital beds for those that really need it. And the elective surgery ban is really only for hospitals that have less than 10% capacity. And so they're trying to, in those hospitals that have few available beds, they're trying to hold on to those beds for people who really, really need it. Now, we will hope that things stabilize and that our hospitals we will not go back to the days when, there were not available hospital beds. But that all depends on the numbers. And one of the good things we can say is that even though our numbers are increasing, our hospitalizations have not increased to the degree they did when we were at these numbers before. And I think that's largely because we know that people who are fully vaccinated tend not to get serious disease, tend not to be hospitalized. So that in itself is a reason for people to listen to the message and understand that we are trying to protect our hospitals, trying to keep people from getting seriously sick, from needing hospitalizations, and trying to maintain available hospitalizations. And how we do that is through vaccines. And so if you haven't been vaccinated, I can't say this enough times, please get your vaccine. If you need a booster, if it's been more than 6 months, please get your booster.
Dr. Sherlita Amler is the Westchester Commissioner of the Department of Health. Dr. Amler, how do you answer people who say, and I had someone say this to me a couple of days ago, someone who I know is, I hate to call her an anti-vaxxer. She doesn't get her vaccine because of religious reasons. I can understand and respect that. And she said to me, come on, John, this is going to be something like the flu and the common cold every year. And we have to learn to live with COVID, and you have to learn how to live with it too. How do we answer somebody like that?
Well, I don't think we have enough information yet to know if COVID is going to become endemic in our society, like influenza. And so some people think that, we will eventually just take a shot for it every year like we do the flu. I think only time will tell us that. But I think the important words that you said there is, are we going to live with this? And I hope everyone lives through this pandemic. And so how do we maintain our health? And again, it goes back to the fact that the only thing that we have going for us besides masking and social distancing and avoiding crowds is vaccines. So if you're not vaccinated, you really have to be extremely careful where you go and what you do. And we know that people who are vaccinated are less likely to get COVID. So children who are vaccine eligible age, who are exposed to COVID, aren't required to quarantine at home. They are allowed to continue to go to school and get their education. I think that's very, very important. A lot of venues won't allow you in if you're not vaccinated, but that's a decision people have to make for themselves. They have to decide whether they want to not attend things that require vaccines, if they want to be quarantined, if they have an exposure. And those decisions are largely on them. But the safest thing to do for your health is to get the vaccine.
Right before we sat down, I ran into a neighbor on the street and she didn't have her mask on, and I did. And I pulled my mask down and I said, hey, where's your mask? Don't jump the gun. And she started to laugh. And I know she's fully vaccinated. Her entire family is too. Should we be gathering in large groups with family, friends this holiday season, like we did for Thanksgiving a few weeks ago and like we did pre-COVID style too? Or are we jumping the gun here?
Well, we know our numbers have tripled since before Halloween. So there is a risk in going to large gatherings. And so I think it depends on your personal health. I mean, somebody who is older, somebody who has immunocompromising medical conditions, who knows that if they get COVID, it might not be a good outcome, has to think a lot harder about this decision. And then it depends on where are you going. I mean, if you're going to a small family gathering and everyone is vaccinated, had their boosters, and there's an agreement in the family, if you're sick, you're going to stay home, you're not going to come. And if there's going to be anybody there that you have concerns about, everybody makes the decision before we go, a couple of days before the event. We're all going to go get tested, so we'll know our COVID status. There are ways that you can do these things in a relatively safer manner. I won't say safe, I will say safer manner. And so, like I said, that would be, if you're ill, do not go to a family event. If you have concerns, go get a COVID test. Please be vaccinated and have your boosters. And, if any other concerns, there's always the additional measures of, masking and trying to social distance and keeping the numbers of people in attendance small.
You bring up the words you use make me think of something specific, and that specificity is how accurate are home COVID tests? I know those who say, well, I might get a false positive. That's my biggest worry. Might screw up my life for 2 weeks. So why do that?
Well, I'm much more concerned about the people who get a false negative. And unfortunately, antigen tests are just not as accurate as a PCR test. And so some of the home test kits come with two actual tests. And so the idea is you take a test today, and then in a day, you take a second test. So you're kind of making certain that test was relatively accurate. And so that's a little bit better than just taking a simple single antigen test and assuming that all is well. But, if you are having any symptoms at all, I would definitely, suggest that you get a PCR. It's not that difficult there's tests everywhere. I mean, a lot of the pharmacies are doing tests. Westchester Medical Center is still doing COVID tests. If you go onto our website, you can find a link that will, help you find someplace close and convenient to you. Most of these tests are still free. So if you go onto our link, which is www.westchestergov.com/health, you can find both sites to get tested and sites for vaccine.
Mm-hmm. Now, here we are in December. Christmas is 2 weeks away. What are your best holiday and flu season, holiday, COVID, and flu prevention tips into the winter?
Well, last year, interestingly enough, when we were social distancing and masking and avoiding large groups, we didn't see flu really. It was a relatively, probably the quietest flu season I've ever had in the time that I've been in medicine. But already we are starting to see flu cases this year because people are getting out more, and so flu is back. You can get your flu shot on the same day you get your COVID shot. You do not need to wait. It's perfectly safe to get them together. They'll just put one in one arm and one in the other arm. And then, that does increase your protection. Just a reminder that on a bad flu year, about 30,000 people in this country can die from plain old regular run-of-the-mill flu. And so getting both, is a really good idea. And again, just back to all the things that we talked about before, especially getting tested. And now a lot of labs can actually do a test that covers both flu and COVID at the same time with the same specimen. So you can ask, is this test going to tell me both if I have COVID and flu? Because there are multiplex tests that test for more than one virus.
Mm-hmm. How do we respond to people who say, and I've had a number of people say this to me, these are people who will not go get their vaccine. Oh, come on, John, look at how far down the flu numbers have been the past 2 years. They just tell everybody they have COVID now when maybe they just have the flu. And I had the flu 3 or 4 times the last few years. Maybe it was COVID and I've lived through all of it. So what's the big deal?
Well, unfortunately, people used to tell me all the time, I've never had a flu shot. I never got the flu or, and nothing bad has ever happened to me. Well, both with COVID and with influenza, if you get a bad outcome, if you end up in the hospital, if you die, you don't get to say, wait a minute, time out. I meant to get my shot. I want to redo that. I mean, that decision is done and you don't get to go back. So it's always better, I think, to prevent disease than it is to try to treat disease. And so by taking your flu and your COVID vaccine, hopefully you never have to experience either of those infections. And we can for influenza, we can immunize children as young as 6 months of age and up. course, still for COVID, we're not down to those age groups yet, but hopefully we will be at some point soon. But certainly for very young children, there is a vaccine. For influenza. For influenza.
And I'm glad you brought up the part about you don't get to call a timeout. And I know I've mentioned this before in talking with different people. A long ago, colleague of mine who was pretty well known and nationally on radio and TV now, Farrell Levitt, who was his real name, and his on-air name, Dick Farrell, who was a Long Island radio colleague of mine back in the 80s. And then in Westchester in the 90s, I was at WFAS. He was at WVIP in Mount Kisco at that time. And he was very much an anti-vaxxer. He came down with COVID. He passed away a couple of months ago. And he made national news upon his passing because in the final weeks before he knew that he was in all likelihood not going to beat COVID at that point, he said, I made a big mistake. Go get a vaccine. He did not get to call a timeout. And I think the biggest case we can make for vaccines is that more than 5 million people have died around the world. I'd rather take my chances with a vaccine, even if I get some kind of a reaction, than take my chances against COVID, which I know that given my druthers, I would not have to try to beat that, and odds are I may not beat it.
I absolutely agree with you. This is the premise, the tenets that public health is built on, that, we do whatever we can to prevent disease from occurring, because it's always so much better to prevent disease than it is to treat it. And that's just the line of work that public health is in. It just makes a lot more sense.
Mm-hmm. Now, besides your website, obviously listing places where you can go get tested and also where you can get vaccines countywide, give us the website one more time, all contact info, any pertinent phone numbers, and social media too, which is key in helping to fight COVID, helping to fight the spread of COVID, and maybe one day we can knock it all out.
So you can go to westchestergov.com/health. We have facebook.com/WCHEALTH department. So Westchester County Health Department. That's for our Facebook. Twitter.com/WC Health Department. Our phone number is 914-813-5000. And our clinic line number is 914-995-5800. So, we're out here. We're always happy to answer questions for people. We just want everyone to have a wonderful, healthy, and happy Christmas. We want to get into the next year. And we also look forward to the world getting back to normal. But, the only way we do that is the things that we've talked about. One thing that I forgot to mention earlier, and that is the boosters for Johnson & Johnson. And there are a number of people who got Johnson & Johnson when we thought that a single dose was enough to provide protection. But now they realize that Johnson & Johnson single dose, the immunity wanes. And so people who got Johnson & Johnson need to go, if it's been more than 2 months, they need to go and get a booster. You can get a booster with Johnson & Johnson, or you can choose to get a booster with Pfizer or Moderna. And for people who had COVID, they had the natural disease and feel like, hey, I had the disease, I don't need to get vaccinated. Unfortunately, the natural immunity that the disease provides you also wanes with time. And so we would really encourage you, if you've had COVID, to still go get vaccinated and boost that immunity so that you don't end up with severe disease, hospitalization, or unfortunately, that you don't die.
And I think we found by now that we can mix the different types of vaccines, Johnson, Moderna, Pfizer. Just if you want to go to a place where they don't have, let's say you had Moderna the last time, you go into a place where they have Pfizer, let them know you had Moderna before, although your card should say that, right?
Yeah, the card will say what vaccine you got.
Mm-hmm. Dr. Sherlita Amler, Westchester County Commissioner of Health, we thank you as always for joining us on Westchester Talk Radio. Much appreciated. Happy holidays. And Let's talk again in the new year, and I hope by that time we can finally say maybe we are getting a step or two closer to back to normal. We shall see.
That would be lovely.
That would be Dr. Sherlita Amler here, Westchester Talk Radio. I'm John Marino, and this is what's happening in the Lower Hudson Valley on Westchester Talk Radio, produced by Sharc Creative, made possible by Robeson Oil, the house that service built by Lipolis Electric. Don't be left in the dark. Get Lipolis. By Hightower Westchester, managing your wealth to a fiduciary standard. By White Plains Hospital. By Michael Labriola Landscape Design and Construction of Armonk, and by Tompkins Meadowbank Bank. Catch all of our Westchester, Rockland, Putnam, Dutchess, Orange, and Fairfield County talk radio programming on our YouTube channel, Sharc Creative YouTube, and go to our app. We have one now. Download it, take it with you anywhere and everywhere you go. It is called Westchester Talk.